Hello, and welcome to the course, Antibiotics, Is It Right? Presented by Heather Bird, an MSN student at California State University, San Bernardino. Presented for bedside RNs and any other healthcare professional whom prescribes, gives, or fills antibiotics as part of their daily duties. By the end of this video, the viewer should be able to name the appropriate reasons for an antibiotic order, distinguish between prophylaxis and treatment, identify proper antibiotic orders, identify where to find documentation of infection, and lastly, identify what qualifies for antibiotic usage according to the Joint Commission and CMS. For the purpose of this video, I interviewed 4 separate bedside nurses and asked them the following question. What are the 4 correct reasons for ordering and giving antibiotics? Here's what Rita had to say. Go.
The patient has an infection. He has a fever, he's coughing. The doctor said so.
That's all you can think of?
Yes.
And to tell you the truth, Bert's answer wasn't much better.
The 4 reasons why we give antibiotics, at least according to the SCIP reports that I've read, are 1, fever, cough, leukocytosis, or other, which is usually prophylactic, ad infinitum. Like they give it 21 days.
I thought for sure Joe's answer would be better, but...
Is there 4? I thought it was only for infection. Well, I guess if the doctor thinks it's necessary, like for a fever or something.
Melissa was my last hope. Here's what she had to say.
Infection, if we're suspecting infection, dirty wound, or for surgery for prophylaxis.
That was the exact answer I was looking for. But wait, is it really that easy? I know what you are thinking. There are so many more reasons for ordering antibiotics, but we really can simplify it. We just need to ask ourselves, is it right? If your patient is on antibiotics, that's the most important question to ask. Is it right? R is for rule out infection. This is when we have signs and symptoms of an infection, but not a definitive diagnosis. But remember, it must still be specific, such as rule out pneumonia, suspected surgical site infection, rule out UTI. We cannot just rely on the signs and symptoms, such as fever, leukocytosis, or cough. I is for infection, a true infection documented in the chart by a licensed independent practitioner, such as pneumonia, UTI, or surgical site infection. G stands for gunshot wound, or any other open injuries. If the patient has a stab wound, open long bone fracture, or even a bowel perforation, they would fall under this category. These can be considered prophylactic or treatment antibiotics, depending on how you look at it. Prophylactically, we are preventing an infection from happening due to these open injuries. Or we could be treating an infection that has already occurred in these open injuries. The H stands for had a surgical procedure. If your patient had a cardiac surgery, they should be on prophylactic antibiotics for 48 hours. All other surgeries should have prophylactic antibiotics discontinued within 24 hours. These are the true prophylactic antibiotics and are used to prevent surgical site infections in all surgical procedures. Lastly, the T stands for treatment for a chronic condition. Some patients are being treated long-term with antibiotics when they have certain conditions, such as lupus, rheumatoid arthritis, chronic UTI, or even ulcerative colitis. Please check with your pharmacist, or even your core measure RN, to see if your patient's condition qualifies for the use of long-term antibiotics. So there you have it. It really is that easy. If your patient is on antibiotics, you just need to ask yourself, is it right? But remember, all of this must be documented by a licensed independent practitioner. If it's not found in the chart, it didn't happen. Now you may be asking yourself, where can I find this information? How do I know if the physician is charting in the right spot? Well, to answer your question, I would always start by first looking into Meditech. First, find your patient, then look into their departmental reports. In there, you can find the H&Ps and the consult notes. Take a look at your patient's history and physical, or consult notes, to see if any of the physicians have mentioned anything about infection. In this consult note, we can see that the physician states acute cholecystitis. He is stating an infection here, which counts for the use of antibiotics. In this H&P, we see the physician state the possibility of pneumonia and possible sepsis. This is the same as a rule-out infection diagnosis, which is also acceptable. As a reminder, labs such as elevated white count and positive cultures are signs and symptoms and do not count for proper antibiotic order. If you cannot find proper documentation of antibiotic administration in Meditech, you could always look in the hard chart. Oftentimes, physicians will write a reason for antibiotics right under the antibiotic order. This is an example of a proper antibiotic order. It states Levaquin for rule-out pneumonia. But always look closely. Just because there's a reason doesn't always make it right. This antibiotic states Levaquin for leukocytosis, which is a sign and symptom of infection, not a true rule-out or prophylactic treatment. Antibiotics ordered for leukocytes in the urine is not a proper order and needs to be clarified. Please remember that if infection or rule-out infection is not documented in the chart, the reason for antibiotics must be written under the antibiotic order, like this one shown. If it's not, the order must be clarified.